My name is Andy Russell. I am an emergency medicine physician at Williamson Medical Center. I've been working there for the past 21 years, and I want to thank Mayor Moore for asking me to moderate this panel here this morning. I'd like to start just by introducing some amazing women who are doing some amazing things for the community here this morning. So on the end down here, we have Kathy Montgomery, who is a director of the Williamson County Health Department. Next to her is a lady who needs no introduction. From the Franklin Police Department is Chief Deb Faulkner.
It's kind of cryptic. That's like they've all been in trouble.
And then to my right, from the Williamson Prevention Coalition, excuse me, Brittany, I'm totally blanking on your last name. I'm sorry.
Laborde.
Laborde. Sorry. Got up here and get my notes and I get all flustered. And she's going to help talk about things that the Prevention Coalition is doing. Talk about what are some of the things that we're seeing in the community as far as drug trends and such. So we're going to start just, Kathy, let me have you kick it off if you don't mind. Can you talk to us a little bit about some statistics about mental health in the community in Williamson County and what the health department is doing to help?
Absolutely. Thanks so much, Andy. And I'm just going to stand if I can because I want to be able to see the slides. Plus, I just like to walk around when I talk. It's an honor to be here, and obviously to follow Dr. Frist is a little challenging for me. When I was putting the presentation together, I was kind of equating it to that Clint Eastwood movie, The Good, the Bad, and the Ugly. So we're going to start off a little bit with the good stuff, okay, in Williamson County. First of all, according to our county health rankings, Williamson County has ranked number one as the healthiest county in Tennessee since 2010. Our adult smoking and obesity rates have been lower than the state rates, and in addition, I'm happy to report that we are no longer number one in excessive drinking rates, okay? That honor was shifted over to our neighboring county in the east, okay? So social and economic factors really do strongly influence the health of individuals and communities. And I'm happy to say that Williamson County has always ranked and is ranking number one in high school graduation rates, because we do have some of the highest rates, the lowest rate in the state of Tennessee for poverty, and also very low violent crime rates as well. Our access to health care and good quality health care in our community is outstanding. We are still seeing a need, like Senator Frist mentioned, of needing more healthcare providers that are targeting mental health. So that is something that hopefully we'll be addressing in the future. So let's talk about some of the leading causes of death. Not uncommon for Williamson County and other counties in the U.S. even, our cancer rates and heart disease are obviously number 1 and 2. A little more surprising for me was that in 2022, our COVID-19 was actually our third leading cause of death in Williamson County, even though we had done mass vaccinations in 2021. But I want to really point out something here, that if you look at all the top leading causes of death, with exception of accidents, most of these are chronic conditions, with exception of number 10, which our number 10 leading cause of death is suicide in our county. So the Department of Health, and specifically the Williamson County Health Department, we've been actually looking at data since 2013. So over the last 10 years, we've been looking at suicide data. And quite frankly, we get that data from our state medical examiner's office. We've had 277 deaths due to suicide in our county over the last 10 years. Now, the Find Hope Franklin Group, we have really been working strategically and hard on trying to address suicide rates through social media campaigns, through QPR sessions, and so forth. And I do want to point out that in 2023, last year, we did see one less death than what we saw in 2022. But what we did find as well, when we look at the data and we look at ages and we look at demographics and genders and so forth, what we did find was that we saw more women last year commit suicide than in the previous 10 years alone. So we had 10 women that actually committed death by suicide last year. And we're also seeing that they're committing suicide in more horrific ways. Historically, we've always seen that women will typically commit suicide by overdose, but these are in more horrific ways. So a lot of times it's interesting when we look at the months, okay, look at the calendar months. And if you were to ask anybody on the street, what months do you think are most prevalent for people who might want to, who commit suicide? Most people would probably say around the holidays, December and so forth. But what we find over the last 10 years is that June, July, and up until last year, October, were really our highest rates of suicide in our county. So it's just really interesting to see. Obviously, we broke this down by age and gender. So middle-aged white males are our typical demographic for people who commit suicide in Williamson. And I will tell you this, that every time Find Hope Franklin does an initiative in our county, we always do it strategically to impact our highest rates of suicide among our demographic population, and we'll always target those months where we see higher suicide rates. So that's really the bad stuff. Here's the ugly stuff. We've been working with Williamson Health over the last couple of years to provide us data based on ICD-10 codes of people that are coming through just their emergency room. So these are Williamson County residents based on their zip code, okay, and only through Williamson Health. So let me just say with full disclosure that if anyone maybe took their child to Murray County or to another hospital, those are not included in this data. This is only Williamson Health data. But what we are seeing is that when you look at the number of children 0 to 18 years old, you're talking about 37% over less than a 3-year period who have been to the emergency room at Williamson Health, either with suicide ideation or suicide gestures. And if you include the 19 to 30-year-olds, we're up to 59% of all of those who came through the emergency room as with suicide ideation and gestures. We broke this down too by looking at months. So we wanted to look at over the year of 2022, were there some correlations with suicides and also ideations and attempts? And what we found, not that much, okay? This is for all ideations. But we had 475 attempts and ideations in 2022. In 2023, we actually saw a little bit of a reduction, which was great. But again, January and May, which didn't correlate even with the year before. And what I will say is that we've gotten data for this year up until August, and we are significantly lower with 275 right now that have been through the emergency room, but significantly lower than what we saw last year. I will say that Find Hope Franklin received a grant, and we strategically targeted movie ads that were specific to our youth, and 988 videos were showing during movie ads all through the summer months. And I noticed that for June, July, and August, we saw significant decreases in the number of kids or the number of people who had attempted or had suicide ideations compared to the previous 2 years. So I'll just say that The agencies affiliated with Find Hope Franklin, and thank you, Mayor Moore, for starting that group, are committed to working together, to trying to address these issues, to looking at the data, and again, trying to address issues in our county around mental health and suicide. So I'm going to turn it over to you, Andy.
Great. Thank you, Kathy, very much. And I'll just kind of tag on a little bit since you mentioned some of our data here. We are seeing the numbers of mental health patients plateau to a degree, and I've got some slides in here that'll kind of point to that. First we're going to play a video.
Research shows mental health is as crucial as physical health to overall well-being, but it's not always treated that way. I'm Jason Waller, and today we're exploring how Williamson Medical Center's emergency department supports individuals experiencing mental health crises. First, it's essential to understand that Williamson Health is not an inpatient psychiatric or mental health treatment facility. But even so, the team here is dedicated to doing everything it can to provide compassionate care to every person who walks through the ER doors, including people facing mental health challenges. I would love to learn a little bit more about the FlexPod. Can you share about that?
Sure. So Williamson County, like the rest of the country, is seeing a rise in substance abuse issues and mental health issues. And patients in acute crises do show up here for stabilization and assistance, and we want to do the best we can for all our patients. So as a part of our renovation, we've carved out an 8-bed secure area. And these are 8 beds that are ligature-free, and they're centered around a central nursing station with increased security. These rooms are outfitted with equipment where a patient cannot harm themselves. So there are no sharp edges. TV or other equipment is enclosed in shatter-free glass. We have a garage door that you can pull down, and so that the patient cannot access the medical equipment to harm themselves.
Williamson Medical Center also provides around-the-clock access to psychiatrists via telehealth, ensuring patients always have a professional expert available for consultation. But technology is just one means of support. A community partnership allows for a dedicated provider in the Williamson Medical Center Emergency Department to help guide patients to their next stage of care.
We recognize that it's a growing need, and we really hope that we're going to be able to help some patients and fill a void in the community that exists.
This has been absolutely fantastic, just sitting down and meeting with you and the rest of the team and seeing everything that's been going on here at the hospital. And as somebody that has struggled with mental health and addiction for over half my life, it means a lot to me, and I know others that struggle with mental health and or addiction, that Williamson Health is taking the initiative and incorporating services that are going to be able to be beneficial to those that are struggling. And so, my gratitude to you guys for doing that and taking a step, because it is much needed. And as we know, there's too many people that are struggling and that need help and that need guidance.
So that was Jason Waller, who you will get to meet later on. He's leading a discussion later on this afternoon. And I'm going to back up a little bit. I've been at Williamson for over 20 years now, and I was sold on a job in 2003 that we are an ER that sees about 23,000 people. And as the population of the area has grown, now last year we're seeing up over 56,000 people. So obviously we're having more patients coming in, and not just more patients, the proportion of the mental health patients is rapidly rising as well. So you can see here, just goes back to just the 2014 data, just over the last 10 years, how the overall volume kind of was going up on a pretty steady rate. During COVID, obviously we had a down year where nobody got out of the house, everybody was in masks, so we weren't transmitting diseases. We did not have a single case of influenza that year. If there was one good thing that came out of COVID, that was it. But then by 2021, once we kind of made it through the first peak of COVID, people were getting more comfortable being out and about and around people again. We started seeing our volume take off again. And as you can see, we're back on that same pretty steep pace. Since we opened our new ER here a few months ago as well, we continue to see an increase. And there's no sign of that slowing down, just with the growth of the community, all the construction, all the great things that our leadership has done to promote Franklin and Williamson County. We're continuing to draw people in, so the hospital is just going to get busier and busier and busier. And we're trying to expand to accommodate that growth, and part of that video just illustrates that as well. As I mentioned, the rate of growth just of the population of our ER volume is pretty significant, but the rate or the percentage of our mental health patients out of that is growing even more quickly. When I started, the proportion of patients that we saw in the ER that were mental health patients were only 3 to 4%. And now it's 8 to 9% over the last year. So again, the proportion of patients that we're seeing that are there for mental health reasons is more than doubled over the last 20 years. And Kathy mentioned as well is our number of suicidal patients. It's kind of leveling off. Again, mental health really peaked during COVID, and prior to COVID, there's based on levels of depression and schizophrenia and bipolar disease and things that Dr. Frist mentioned earlier. During COVID, we had a big spike in our number of mental health patients, and most of those were more anxiety than anything else. And I think that's fairly obvious why. It was a global pandemic, something that we had not been through before. And there was a lot of anxiety surrounding that. You couldn't visit your family, you couldn't see friends, and so people were very anxious and nervous. And as we moved through the pandemic, the levels of anxiety dropped a little bit, not a whole lot, but the number of people that are coming in acutely suicidal and with major depression, again, that really went up. And again, the proportion of patients that were suicidal pre-COVID is much lower than what the proportion of suicidal patients is now. So even though the number of mental health patients, the number of suicidal patients is somewhat leveling off, again, the proportion of our mental health patients that are suicidal is much higher. Again, you can see here coming out of COVID how the number of patients and these are suicidal patients that we had to commit, that we deem are not safe to go home, that they must go to another facility, a psychiatric facility. Our number of patients that we've had to commit to a facility, again, that graph is pretty easy to understand. Again, we've almost doubled, or at least for 2024, we are on pace to double the number of patients that we have to commit to a psychiatric facility. Again, overall, the numbers are kind of flattening out, and I attribute that more to all the resources in the community, all the work that Mayor Moore and Find Home Franklin and others have done to provide more community resources. And while that is having an effect, there's still a large number of patients in the community that are coming to the hospital that we end up have to transfer elsewhere because, unfortunately, we are not an inpatient psychiatric unit. And so what are we doing to help with this whole situation? I don't want to go through and replay the video frame by frame, but you can see here, we talked about the Flex Pod in that video. And so our old emergency department was 27 beds, and through this latest expansion project, we've moved up to 43 beds. Unfortunately, it's not uncommon for mental health patients that are uninsured to be in the emergency department for 5, 6, 7 days at a time. And that's because Middle Tennessee Mental Health Institute is the only state mental health hospital in the region. They are about the only people that will take uninsured patients. So if you do not have insurance and you come into the emergency department and you're acutely suicidal and need to go somewhere, that's really the only option unless you're willing to pay several $1,000s out of pocket. And unfortunately, a lot of people don't have that money available. So those people would be housed in the ER for up to a week at a time. And so things we've done to try and accommodate those, we try to make a more comfortable area for them back in this Flex Pod. It's more comfortable for them, but it's also safer for them. It's also safer for our staff. We've recently added a telepsychiatry service. So now we have 24/7 availability of psychiatry available to see these patients. Other things we've done, we've partnered with Kathy and the health department to have a mobile crisis counselor in the emergency department during peak hours. And even more recently, we've partnered with the Refuge Center and Amy Alexander and have some of their counselors that are coming in to provide free counseling services to these patients. As I said, they're there for several days, and so they can see a psychiatrist via telemedicine on day one. We get started on some medications that based on the psychiatry recommendations. The counselors can come in that afternoon, start seeing those patients. And almost 40% of the patients that we've been committing in the past and are there for days at a time, about 40% of those patients are now getting to go home after 2 or 3 days because they get started on medications. They have a couple of counseling sessions. They become more stabilized, and we feel that they're no longer a threat to themselves. We're able to rescind that committal paperwork and able to let them go home. And we have them set up with outpatient therapy at various programs around the community. So that's been a huge help for the patients. Again, it helps provide them better care, because in the past they were just be in the ER waiting to go somewhere, but now we're providing more resources for them. Again, it's much more safe and much more comfortable for them. We've done lots of training with our staff as well. Every ER staff member, all of our law enforcement and security officers all go through what we call nonviolent crisis intervention. So how do we de-escalate somebody that's come in very agitated? How do you help calm them down, make the scene much more safe and calm? And that's had a great benefit for us as well. And that's really all I had.
How'd that get in there?
That's really all I had. I wanted to talk again briefly just about Williamson, what we're seeing in the hospital as opposed to just the county level statistics and some things we're doing. I want to shift gears a little bit. And Chief Faulkner, can you tell us a little bit about how this epidemic of mental health illness in the community, how does that affect the police department?
Well, first of all, I'm not a patient. Maybe I should be, I don't know. But yeah, you may be wondering, what's the police chief doing here? And I want to thank Dr. Ken Moore, our mayor, for listening to me go on and on and on about this, because I came to work for the city of Franklin a little over 10 years ago, and I remember well, it was a Saturday morning, I was out running errands, and my phone went off 3 different times. We have an Everbridge system that tells me when there's major occurrences, and I had 3 suicide-related calls that morning. So when I came to work on Monday, I asked one of the officers who'd been there a long time, I said, is that unusual? And he thought for a second and said, well, no, not really. And I said, that's not okay. I came from Nashville, and I never had that many calls in Nashville. So I started looking at it, and one of the things that I've recently read was a study conducted by the National Conference of State Legislatures. And in that study it said, a person experiencing a mental health crisis is more likely to encounter law enforcement than to receive treatment or crisis intervention. So I supply you with business, Dr. Russell, and I'm sorry to say that. Police officers are not mental health professionals. We're just not. We're law enforcement people. But we are at the other end of a 911 call 24/7. Many of you have probably called a doctor's office on a certain afternoon, hoping you might catch somebody, and you get that recording. I'm sorry, we're not open right now. If this is truly an emergency, please dial 911. Well, you get Dr. Officer Smith is who you get. And that's okay, because we'll be there. And we do a lot of training, because we know what we say and do in those first few seconds can make or break somebody who's in a severe crisis. So what does this look like in the city of Franklin? That's all we cover. Our jurisdiction's 42 square miles. But a psychological emergency is one of our leading calls for service. Last year, Franklin officers responded to 142 calls that were related to suicide. The oldest person was 92 years old, and the youngest was 10. For the first 9 months of this year, there had been 97 suicide-related calls. The oldest person was 73, and the youngest was 7. Now, I don't know about you, but when I was 7 about this time, I was trying to figure out if I wanted to dress as a black cat or Cinderella for Halloween. Wasn't thinking about killing myself. 26 of these 97 calls this year have been juveniles. Last year, officers responded to 62 overdoses, and every officer carries Narcan. And usually when they get one of those suspected calls, 3 or 4 officers will respond. We can get there a lot quicker than a honking ambulance or a fire truck. And it'll take every Narcan in the room. And then even when the ambulance gets there, they have like a super dose, and they zap them again. And I'll tell you, I would love, Dr. Russell, to meet the person who invented Narcan, because it's just like something, if you've never seen it, in the Bible, where someone puts hands on somebody who's dead and they rise up. they shoot them with this Narcan and they look around like, what's going on? It's amazing. We also have breaching tools in our car. You may think, what the heck? Well, a hammer and a wedge, it goes a long ways when you need to get into a house quickly. We had a call recently where the person was making suicidal ideations to a friend, and so they called the police. The police got there, they went around the house, they looked and they thought they saw something in the garage. No one would come, so they broke the door down, went in, the man was hanging himself. So they had a knife and they had gotten in quickly and they got him to the hospital. It's funny because I bought just about all the hammers and wedges that they had at Home Depot, and the manager at Home Depot called me and said, I'm starting to worry about our police department. Can I talk to you? I said, trust me, we need them. Don't worry about it. But I think a number that really demonstrates concern regarding mental health is the number of welfare check calls that we receive. And last year, Franklin officers received 6,796 welfare checks. For the 9 months of this year, it has been 4,559. That's about 16 a day. Examples of these calls could be, and these are ones that I've heard, someone's disoriented walking down Carruthers. It's cold weather out, they're barefoot. Could you sort of check on them? Well, of course we did. Someone hasn't picked up their mail in days, and the mailman thinks that's ironic, and thank God he called, because that was another situation that we had to breach the door, and a woman was inside. She was very disoriented. We think possibly she'd had a stroke, but she had been in her floor with a hurt hip since Monday, and this was Thursday. They won't answer their phone. They haven't shown up for a doctor's appointment, and that's unlike them. Or they've missed other appointments, or they've missed work. There are multiple notices on a person's door, and a neighbor thinks that that's unusual. Often these calls are where a person lives alone. I think Dr. Friss mentioned that. Officers responded to 3 DOAs in a single day recently. 2 of the 3 lived alone. 1 was a suicide, 1 was an overdose, and 1 was a medical death. In a lot of cases, the person really doesn't know their neighbors, and we'll often talk to the neighbors before we start breaking doors down. Well, I really don't know them. They moved here from out of state recently, and I don't see them very much. But that's their car right there. Well, we know because we ran the listing on the car. But most of their relatives live out of state, and they can't make contact, so they call the police. It's not unusual for officers to find that person in need of medical attention, and in some cases, they're DOA. Now, I want to shift gears just for a second because this is the second issue that I'm extremely passionate about. October is Domestic Violence Awareness Month. And you may think, what's that got to do with Franklin? Because we have all the best of everything. We do. Our demographics speak to that. From January until September of this year is 274 days. During this time frame, Franklin officers have assisted 250 domestic assault victims. Now just think about that for a second. Almost every day. Love isn't supposed to hurt. I know you've heard that before, but it's true. And we can provide safety and security for someone who's in trouble. And at the risk of sounding like a preacher at the end where you make the invitation, I just want to say that there's a lot of helpers here today. If you know someone who is distressed, or they're making unusual statements out of character, maybe they're giving things away, and you think, well, that's important to you. Why are you giving that away? Or if you suspect there's violence in the home, please tell somebody. Tell somebody that's here today. In my career, I remember when no one would talk about mental health or violence in the home, except in hushed tones, or they make gossip about it. But I'm thankful we can now shine a light on it. It's an important topic, both domestic violence and mental health. And we need to continue to collaborate like we're doing here today on successful strategies to help one another. So that's it. I'm Debbie Downer, and all y'all are too.
Chief Faulkner, thank you. Again, we're going to shift gears a little bit more now. I want to ask Brittany to talk a little bit about her work with the Prevention Coalition. I grew up in Memphis, and I remember thinking, when I went to high school, there were a couple bad kids that you think, oh, they smoke pot, but that was really about the extent of the drugs. Unfortunately, things are a lot different now. Kids have a lot more options. We see lots of different drugs in the emergency department. So, Brittany, can you speak on that a little bit, please?
Sure. Chief Faulkner mentioned having to go to a scene where there's maybe an overdose and having to give multiple doses of Narcan or naloxone. In Williamson County, we had 46 fatal overdoses in 2022. 30 of those involve fentanyl, so we are seeing a lot of fentanyl on our streets and in the drugs that we are confiscating. Unfortunately, people are mixing substances. Fentanyl is laced in other substances. We had 24 of those 46 overdoses involving multiple substances at once, whether somebody was purposely mixing substances or unknown to them, there were multiple substances in their, what they were using. It's really important to talk about overdoses as well as when we're talking about suicide, because not all overdoses are accidental. Some are intentional. They get coded maybe differently at different times for different reasons, but it is a huge problem and a big problem in Williamson County among our youth. Unfortunately, we have had youth overdose. We are now supplying all schools with naloxone or Narcan, whether that's for students or for people who are maybe visiting the school for whatever reason. And this is a serious problem that's affecting our youth. It is important for us also to talk to youth at an early age. So average age of first-time use in Williamson County is about age 13. And so talking to our kids at a younger age is really important. Talking about safe use of medication, not sharing medication, I think is the most important thing early on. I even talked to my 2-year-old about it. Somebody last night at a presentation was asking, how young should we start these conversations with our kids about substances? I say it's never too early to start. Making sure that they are using over-the-counter medication safely and not using anything else. Locking up prescription medications. Part of one of the great services that we offer at the Williamson Prevention Coalition is free medication lock boxes. I believe we still have some outside in the lobby now. Locking up prescription medications keeps it out of unwanted hands. So keeps young kids maybe who are curious from trying other things, keeps people who are maybe coming through your house. Maybe you don't know what a friend or family member is going through, and you want to have that extra barrier to protect. We also recommend disposing of those unused, unwanted prescription medications. This weekend, actually, we have a drug take-back event. And it's a nationwide DEA drug take-back event. We partner with our local law enforcement. Another really important thing to talk about when we were talking about fentanyl, fentanyl is an extremely powerful substance. It's 50 times stronger than heroin. So when I first started doing this work, I didn't really understand, I didn't have a point of reference of how potent fentanyl is. So I think this is really important to keep in mind how much more potent it is than even morphine or fentanyl, or heroin, other opioids that we might have heard of previously. There is a different type of fentanyl that's actually 100,000 times more potent than morphine, called carfentanil. And these drugs are just getting stronger and stronger and stronger. It's really scary what our community is being exposed to. There's another substance out there called xylazine. So xylazine is an emerging drug. It is emerging as being abused substance, but it is not a new medication. It is a veterinary tranquilizer. So it's intended for large animals. It's not intended for human consumption. However, somebody decided to try it and realized that it might extend the high or get them high in different ways. So we're actually seeing xylazine laced in other substances as well. So not only is fentanyl laced in substances, xylazine is now also laced in substances. So it's something to be aware of. Xylazine is also causing severe wounds. It causes necrosis of the soft tissue, so kind of eats away at the soft tissue, causing really severe wounds that expand very quickly and oftentimes get infected quickly. So it is also important for us to be aware of all the stuff that's out there. I think knowledge is power, and having Narcan does not reverse a xylazine overdose, but it does reverse a fentanyl overdose. The likelihood that fentanyl is mixed with xylazine is pretty high. So I think 3 out of every 4 overdose in Tennessee involved fentanyl. So when in doubt, have that naloxone on hand so that we can be safe and protect our community.
Thank you very much. And I'll tag on onto that. Just we see a lot of these patients come to the ER after they've been given Narcan, or they're found unresponsive if family or friends don't have Narcan. And I ask the people, once we stabilize them and have them awake and talking, I ask them, what do you think is going to be in your system? Because we do drug testing on all these patients to know what we're dealing with. Most of them don't think that they've ingested fentanyl. Most of them think they are taking pills that they bought from somebody off the street. Again, they don't know what's in those. So it's exceedingly common that people come in thinking they're taking a hydrocodone or a Xanax or something they buy from somebody, and it's a pill that's been manufactured somewhere else that's been laced with fentanyl or xylazine. Excuse me. And that's where they get into trouble. As Brandy mentioned, it's a very small amount of fentanyl that can cause problems. Our normal dose of morphine, if you come in, you've got a broken hip, you're probably going to get a dose of 4 milligrams of morphine. A normal dose of fentanyl is 25 micrograms. So again, less than 1,000th of the dose of morphine. So one of her slides said a dose of 2 milligrams of fentanyl is enough to kill somebody. That's a huge dose. That will kill multiple people. Excuse me. And if a child were to get a pill that's laced with even a small amount of fentanyl, it can really, really cause some bad problems. I want to ask just throughout the course of the conversation, a couple things kind of perked my interest. Chief Faulkner, I know you mentioned all these welfare checks. Your officers are going in finding people in various conditions. That's a very stressful thing for the officers. What is the department doing to help with the mental health of the officers?
Well, I often say it's my job to protect the ones who protect us. So we have 26 officers who are trained peer supporters, and they create what you might call a no judgment zone. They will meet their fellow officers somewhere and just let them talk or talk to them or reach out to them, sometimes just for advice or just to have somebody to vent to. And each of these officers wear a pin. If you ever see an officer wearing one of these, it's because it says, I'm a peer supporter. It has our badge on it. And that coincides with a coin that I give. Some of you may know about challenge coins. It has our badge on it, and then on the back it says peer support, in this family no one fights alone. So we give that in case they're having a bad day. They can sort of pull that out of their pocket and think about it. And something else you may or may not have noticed if you've seen a Franklin officer is that I have 38 military veterans, and I give each one of them a pin to wear on their uniform. It goes like right over their name tag, and it says military veteran. It's red and blue. I do that for a number of reasons. Number one, I'm proud of them. You know, I was born into the Army. I was born at Fort Benning. But also number two, and I've heard that I really hope that it would be a catalyst for discussion. People in the community would come up and say, oh, you were in the military, so was I. And then there's a conversation. And then the third thing, which ironically has happened, is that when you answer one of these calls and someone is having a PTSD moment, they can look at that, and I guarantee you it's already occurred because officers have told me and said, oh, you're a veteran, you understand. And so again, there's an open link for conversation. So I gave a new officer one of these yesterday who was from a veteran in the Air Force. I had 2 officers of this 38 that were deployed last year, one to Europe and one to the Middle East. They were gone not quite a year. And one is a female detective, and she's the first female to receive the Silver Star since World War II. She received that from her service in the Middle East. But one of the things we always do as a part of our policy, I think it's a good practice, but also as part of our accreditation, is to bring them in and talk to our counselor, who's Dr. June McHenry. And she does several one-on-ones just to make sure they're good to go and work the streets again. They're both now sergeants at the Franklin Police Department. We do critical incident debriefings for our personnel who respond to stressful calls like some of the ones we're talking about today. A good example of that is in August, we had 2 completed suicides on the same shift. They both happened on the night shift. And there were new officers that had never seen a suicide before that responded to that with their training officer. So our peer supporters were there to sort of monitor that, and supervisors monitored the need for a critical incident debriefing. I recently saw a poster that said, "A badge gives you an all-access pass to everything you wished you'd never seen." And that's true, even in Franklin. So that's some of the things that we do.
Great. Thank you for, because I can't imagine the emotional stress that they're going through and the things that they see, because they see them before they bring them to the emergency department, and I have to see them. I know that's hard on them. Kathy, out of all the patients that are coming through the health department, how would you describe the connection between their physical health and how that relates to their mental health?
Well, in the local health department, let me just make sure my microphone's on here. It's off. One of the things that we've done in the local health department that's really seemed to help quite a bit with the transition of our patients is that volunteer behavioral health services is in our clinic now. So let me just say, full disclosure, we don't work their patients up, we don't check their patients out, but volunteer does take TennCare, and they also accept uninsured. So it's been a tremendous partnership for us when we're seeing a primary care patient who might be experiencing depression, substance misuse, and so forth, to be able to walk them right down the hall to be able to access mental health services in our facility. And I will say that Williamson was one of the first to kind of kick this partnership off, and now Volunteer is actually in several other local health departments, particularly down in the South Central region and over in Jackson, Tennessee. So that's been just a great partnership to have with them. So if you're here, Volunteer, thank you.
Okay, thank you. And Brittany, when you were talking about drug use out in the community, I get questions in the ER frequently from friends or parents or caregivers that are bringing these patients in after they've been found unresponsive. How would you recommend that those caregivers help somebody they think might be having a drug problem?
It's very important to have a support system. So sometimes mental health and substance use especially can be stigmatized and maybe leave people isolated, but continuing to support those loved ones, continuing to show up for them, even if they're still struggling and maybe not ready to get the help that they need yet. That's a really important part. We also can offer naloxone overdose prevention training for anybody in the community. I offer a virtual training, but we can come to any business, any person, just even one-on-one. We try to promote that overdose prevention training, as well as giving as many people in the community as we can naloxone to have on hand. So the biggest thing is just continue to support them, I think.
Great. I guess a kind of corollary to that is not just somebody that's having a drug problem, just somebody that's having a depression, you think they might be suicidal. What are things that you can do to help? I know Find Hope Franklin has been really big about pushing the QPR that Dr. Moore mentioned, the question, persuade, and refer. I look at that as it's CPR for a psychiatric problem. Think about how hard we push for everybody to get CPR certified. We have that in the high schools and everything else. This should be standard for everybody. Again, as much mental health as we're seeing, again, if we think somebody's going to have heart problems, we want to be able to care for that, have a layperson take care of that. If we think mental health and mental illness is this prevalent, which it is, we need to prepare our high schoolers, everybody else. How do you deal with that if you're out in the community? How do you recognize the symptoms of that, and then how do you help that? And people ask me frequently, well, especially when people come in after a suicide attempt, it's usually family or friends are like, I have no idea that my friend was in this condition. And as we start talking, a lot of times they'll say, oh yeah, well, they stopped doing things that they've always done. They used to love to exercise and they never go outside it anymore. They used to love to hang out with friends. We never see them anymore. When we do see them, they're always drinking or something. A lot of times if it's with school-age kids, it's their grades are going down. Again, maybe they were part of a sports team that all of a sudden they're backing away from that. They don't want to play sports. They spend a lot of time alone by themselves in their room. And you think, well, this is just normal teenage angst. They don't want to be around the parents or whatever. But those are big red flags. So I always encourage people to look for that. Look for just changes in behavioral patterns. I think that's the first thing you see. I think you see the behavioral patterns before you notice it. Physical signs or medicinal signs of problems, but it's more just being observant of is it your family, is it your friends, is it your coworkers, and don't be afraid to ask. If you think somebody's having a problem, start with the cue, question them. How do you feel? Is there anything I can do for you? Just the more you can do to break down those walls of communication, I think that really, really helps, and that's a great first step. And while I'll be the first to admit, even as a medical professional that deals with this in the emergency department, it's an uncomfortable thing out in the community. I've got 2 daughters that are in college, and I've had both of them come to me, talk about their friends, and they say they're worried about so-and-so. And I always ask them, have you talked to them about it? And they said, well, no, our other friends within that group have all talked about this person, but nobody's gone to this person. You've got to go to that person, and I always encourage them, talk to that friend's parents as well. Let them know that you're concerned about them. But again, it's an uncomfortable conversation for anybody, but it's a very important one, and it can certainly save lives. That's really all I had. Do y'all have any final comments? We'll wrap up a couple minutes early.
No, but when you were talking about some of the signs and symptoms, through some of the interviews we've done with the You Are Not Alone campaign, a couple of times that parents have talked with us, personal hygiene was another big eye-opener for them, that they didn't, that they recognized that their kids weren't showering, bathing, grooming, things like that. And then also weight loss and weight gain. But I agree with Dr. Russell. I mean, we've got to start talking to our kids about this hard stuff and just opening those lines of communication, even if they continue to go, no, everything's okay. It's always good to just keep that communication open and still have those conversations with our kids, because the data supports that our kids are the ones that are going through our local emergency rooms. And so we want to really try to reduce that if possible.
I know that many of you all are in the helping professions, and I want to tip my hat to you and thank God for you, because there aren't enough of you. But a good example happened last week where someone called, I guess it was a suicide hotline, and wanted to know if they knew how long it would take to die if you cut yourself. So she kept him on the line, and another caller called us, and we went to the home, and sure enough, he was cutting himself. But because of the training our officers have had, they got him to agree to go to the hospital. So he voluntarily went, but we made sure we got him there. But had that person not acted the way they did and reacted the way they did, it might have been another tragic event. So thank you for all you do.
And I kind of like that. Those are a cry for help. We get people come in all the time, and they made either a little superficial cut on their wrist, or they said, oh, I took 5 Tylenol tablets while trying to overdose. And then I changed my mind and wanted to get checked out. And even when they come in and they've made a minor gesture like that, that's still a call for help. So we're very conservative with those patients. A lot of times they get upset when I say, no, we're going to send you to a psychiatric facility since we don't offer inpatient services. And very frequently they'll say, well, no, I didn't really mean it, or I'm better now. That's a big red flag. Again, that's a cry for help. So if you hear of somebody, friend or colleague that is, taking pills, and we hear all the time, oh, I took 3 Ambien because I just want to go to sleep and never wake up. In my mind, that's a suicidal gesture. And so again, people throw those comments around rather flippantly at times, but again, those are big red flags. So if you hear somebody talk about that sort of thing, be sure to try and get that person some help. All right, Ken, I think we've about wrapped up our panel.
I want to follow up actually with a question if I could.
Sure.
Because you referred to it and Kathy referred to suicide and. I've never done this before. Gone now? There you go. I've never done this before. Andy and Kathy both spoke about suicide. They spoke a little bit about question, persuade, refer, and just want to let the audience know that there are opportunities to get that training. This is a training for everyday people like me and you to understand what to do if people are making these suicide ideations around you, how to recognize them, then how to ask them questions, and then lastly, where do you send those folks? So Franklin Tamara, Find Hope Franklin, we have people that are trained in training this. It's about an hour and 15-minute class. I would urge everybody, if you know CPR, you should know QPR. So if you have an interest in that, you can get with me or Mindy Tate, and we'll work something out for you or a group. So thank you for the panel, and let's give them a great hand. And